Welcome back. The more contagious Delta variant is quickly gaining steam in the United States, now making up more than half of all COVID cases and about 25% of local cases, according to Parkland's Center for Clinical Innovation. Meanwhile, a new study out of Israel suggests the Pfizer vaccine may offer less protection from this new strain. Our Brooke Katz spoke with local doctors.
As the Delta variant spreads, healthcare leaders are growing more concerned.
The one group that I am still worried about is our really young group. If you look at our admissions now, it's definitely skewing younger.
Dr. Joseph Chang is the chief medical officer at Parkland.
Now, when you look at the census of our admissions, we're running more in the 30 to 40-year-old range. That group is really growing high. Well, why? Well, it's because this is where a lot of our vaccine hesitancy is in that age group.
This as the Pfizer vaccine is now said to be only 64% effective against the Delta variant, according to Israel's health ministry. However, Dr. Chang says it's important to note it is still very effective against serious illness and hospitalizations, 93% according to the ministry. Another group doctors are worried about, those too young to get a vaccine.
Even though kids don't get as severely affected with the COVID infection as adults do, they do get fevers, runny noses, cough. And then we have to remember the MIS-C, which is the multi-system inflammatory syndrome in children.
For now, doctors say it's just too early to know how the variants will affect MIS-C cases. It's still very rare. Dr. Mansi Lalwani, a pediatrician with Baylor Scott & White, says practicing prevention is still the best safety precaution for the little ones.
Vaccines are going to be available soon for kids, hopefully in the fall, and then for the very young ones, maybe in the spring of next year. So until then, let's just keep doing our part in hand washing, social distancing, and wearing the masks.
Brooke Katz, CBS 11 News.
Well, something else Dr. Chang says is worth keeping in mind. This new variant could also mean more people dealing with long hauler symptoms.